Hey, what's up, everyone? John Heringer here, Chief Motivator at Method 3 Fitness, and welcome to another Stronger for Today show. Very excited to introduce you to my guest today, Dr. Robert Millard of Stanford Medicine. So, Dr. Millard and I actually go a ways back. He was the one who helped me with my back in 2020. I had herniated my L5S1 disc herniation. He assisted with an amazing transforaminal epidural. I did a lot of physical therapy, and here I am, stronger and more mobile than I was back then, and maybe ever before. A little bit about Dr. Millard. He's board certified in physical medicine and rehabilitation. He's fellowship trained in interventional spine care and sports medicine. Prior to joining Stanford, he was actually also in private practice for 27 years. His practice right now involves the treatment of spine pain syndromes and sports injuries and other interventional spine procedures, such as cervical lumbar, transforaminal epidural injections, facet injections, medial branch blocks, and radio frequency ablation. He served also as team physician for the San Francisco 49ers and the San Jose Sharks. So you're in good hands. So without further delay, my conversation with Dr. Millard. All right, Dr. Millard, thank you for joining me today.
My pleasure. Thanks for having me.
Absolutely. So I'm excited to dive in and talk about, a lot of things with you, but I think I wanted to first start with just my own personal story. Some of our listeners may know, that our partners at Method 3, but back in 2020, I feel like
Yeah.
it was just the weight of everything else. Studio closed for 12 plus weeks. And then right around Father's Day, I have this just this quick little sharp pain in my back. I'm like, oh, that's weird. And then just the weeks and kind of months, all of a sudden, a little over a month went on. I'm like, wow, this is not getting better. If anything, it's getting worse. I couldn't even get up onto my toes on my left foot. There's numbness, there's pain. Connect with you. Thankfully, I think I chatted with probably my mother-in-law. She's like, you got to go see Dr. Millard. That's it. There was no hesitation.
Yeah.
And subsequently got a transforaminal epidural, and then did a lot of physical therapy and was able to, get back to full health. And honestly, now, many years later, I'd say I'm stronger, more mobile, probably in better physical health even than I was then. And I'd say a lot more balanced, because what helped me back then was realize I was a little out of whack with the balance of my program. It was a lot of heavy strength training and not a lot of mobility and core work. So
Right.
let's start. So yeah, I guess first, thank you. But I'd love to
Well, hey,
start with
John,
just,
let me first of all say you were like the dream patient. So
yeah,
you're super fit, and I knew you were ready to go to work and do what you had to do. So again, all credit goes to you at this point, my friend.
I appreciate it, sir. Well, let's get just a little bit into what a transforaminal, without getting, I'm sure you can dive into the weeds on that, but just higher level so people understand what that was. What is a transforaminal epidural? What is it, and kind of what did it do to help alleviate that L5S1 for me?
Yeah, it's a good question. Transforaminal epidurals are really, I think, the best way to address, radicular pain or sciatica pain, or in the upper extremity, radicular symptoms in that area, because each nerve is treated individually. So it's a
Mm,
procedure I do in the operating room under a fluoroscope. So fluoroscope is X-ray guidance, and using your bony anatomy, I can place a needle just a little thicker than a strand of hair right in the space next to the nerve. So each nerve is treated individually. So obviously, for epidurals to be effective, you've got to be an excellent diagnostician too, because there's lots of
mhm.
potential targets in the spine. But it's a very, very effective procedure. Before I place any of the corticosteroid, which is the agent that helps the nerve become less inflamed and irritable, I place a contrast agent around the nerve, and that outlines the nerve sleeve to confirm I'm covering the nerve perfectly in the areas where the MRI has shown me the nerve is compressed. But the corticosteroid basically shuts down the nerve's irritability from, say, here to closer to baseline. And then, as you
Mm,
mentioned, you have to then go to work and do core work. And natural history of disc herniations is that they can heal if you continue to do the right things.
awesome. Yeah, and that's I mean, literally exactly what happened. It kind of took all that inflammation off so I could go do the work. But like we were chatting about, I never forget when you said, "Hey, if you go do the work, I'm going to tell you exactly what you need to do. You connect with your physical therapist, and if you do this, you will get better. This disc will resorb, and you'll be back to what you were doing." So it was, and it was completely true, right? Very humbling experience, right? To literally have to go back to ground zero,
Yeah,
but
it's scary too. I
something,
mean, you're losing
yeah.
power in your calf, and the pain and the numbness. That's all very
Mhm.
disconcerting.
Yeah.
It's a scary time, but if you fight through the storm and you believe in the process, the majority of people will do exceptionally well.
Absolutely. So I'm curious because you've treated obviously just a wide variety of people, right? A lot of elite athletes, and then your everyday people as well. What do you see as some of the differences between them? I'm thinking more so as it relates to recovery. Do you feel that athletes are recovering? Are they putting more, uh, maybe similar to Iowa's, like a lot of emphasis and effort into it, and the kind of normal, everyday general population isn't? Do you see the opposite? What does that look like?
Yeah, that's a great question. I've been extremely blessed. I've treated the Niners for 16 years and Sharks for 10, and I've treated
Yeah.
a lot of collegiate and high school athletes as well over my 34 years in practice. And what I would tell you, first of all, professional athletes are freakish in what they can really achieve with injury and how they can continue to, participate at world class levels.
Mm,
They're obviously highly incentivized, but they're also genetically gifted in that way. And as you know, as we all go through the process of life, the funnel gets a little tighter. And they're selected over the process of playing high level high school, college, and professional sports, many of them. And so these are people that can really perform at very, very high levels
yeah.
with any injury. For instance, there's many professional athletes that I've treated with absolutely huge disc herniations. I've done epidurals and settled things down, rehabbed them, and got them back on the playing field that same season. And when
Wow.
you look at the more typical patient, obviously they're not as well conditioned or incentivized, and they're having a hard time walking around their block, So, but
Mhm,
I think the
mhm,
pressure of professional sports also really pushes them to the edge to, return to
mm,
play maybe sooner than they should because they know there's a young athlete in the background that's ready to take their job. And, there's a lot of pressure to be a professional athlete to compete. Otherwise, you're
yeah.
not really essential to the process of the team any longer.
Yeah, that's obviously that's a huge incentive in and of itself, which you're right. I think typical patients probably don't have as much. So when, in your practice, obviously many years in practice treating a variety of people, what what are some of the, and back pain, right, is it's a common topic that we discuss even in method 3 with a lot of our partners. We specialize in the, 45, 50 plus markets. So um what are some of the most common causes you see? And I'm saying back pain generally speaking. Obviously, there's a variety of things I know that can happen there. But what I'm curious about are some of the most common ones you see that are somewhat preventable, and or um, if we do certain work, maybe we can push off when we actually, are symptomatic for some of these things.
Yeah, I think, the important thing is as you mentioned, spine injuries are really, really common.
Mhm,
And, when I first started my private practice, I actually went to athletic clubs and did lectures and injury clinics and things like that because I knew my job would be a lot easier if my patients were athletic and motivated to exercise because I know how essential that is to success in spine treatment. So the most common injuries that I see in my practice are typically disc herniations in the cervical and lumbar
mhm,
spine and subsequent extremity symptoms. And unfortunately, a lot of the people that are doing these things as we get older in life, we're not doing core exercises and we're still staying very, very active. Many people in this Bay Area, particularly, and you're not doing the foundational work to prevent injury. And
mhm.
unfortunately, people don't get how important core is until they have a significant spine injury, and that's a little too late at that point.
So, when people do have these injuries, I think, most of the time, I'm sure it's pretty evident that there's a problem. But sometimes, especially as we get older, people think, oh, these are just aches and pains I normally have. What are signs that, or how do you help patients understand, like, hey, is it symptoms happening in the extremities? Like I had, I could very the pain I was feeling was not normal for me. I could tell that. And number two, I'm like, I'm feeling numb on my left side and I can't actually go up onto one foot and contract my calf. That's an issue. What do you see? But I don't know. Is that normal for everyone? Are there other things that they should be paying attention to so that they're not ignoring the pain?
Yeah, I think any pain that disrupts life is important to get evaluated, particularly as we age and get older. Things can sneak up on you. So I would tell people that anything that doesn't feel right, that disrupts your ability to do the things you enjoy every day or just the typical activities of daily living should be evaluated by a specialist in a big hurry.
Can you speak to more of maybe why, in your opinion, and obviously expertise over all the years, um, why have you come to see that that specific core training kind of, certain muscles maybe that comprises that you uh, actually instruct patients to kind of work on? Why is that so important as how it relates to spine health?
Well, I think what core strength and flexibility allows you to do is really position your spine in positions called neutral spine that allows the structures that are causing your pain to heal and to recover. So it's
Mhm.
all about using a foundational strength of core. A lot of people rely on external corsets if they have back pain. I always instruct my patients, your job is to get core strong so you have that corset for yourself. So you can use that
Mm,
muscular strength to as a proprioceptive guide if you're getting out of spine neutral. I'm a firm believer in strength and flexibility through the core and through the hip girdle and through the lower
yeah.
extremities are absolutely essential for spine health long term. And if you get into that even before you have an injury, you're probably putting a potential injury on the back burner.
Love it. And that was gonna be one of my things is just, things, especially like the 50 plus community, certain things they can do to prevent or offset some of these things. And it sounds like, you know, overall fitness really, but core training, strength, like you said, strengthening that entire core area, and then mobility, flexibility in and around lower extremity, but definitely the hips as well. Yeah.
Yeah,
Awesome. Yeah, and
absolutely.
that was a big piece for me was tightness in the hips was very evident. And it was one of those things where I should know better. If this is so tight, my body's going to figure out a way, either above or below. It chose above. My
Yeah.
back took the brunt.
Yeah. Well, people
Yeah.
forget our bodies are really a big kinetic chain. And if you're favoring
Mhm.
one aspect, whether it be because it's a painful structure or if it's inflexible, it's going to stress the areas adjacent to it. And that's what a lot of people lose track of.
Yeah, absolutely. So I'm curious, it sounds like, strength is important, core strength is important, mobility, core, all these things. But it sounds like all of them kind of have a good equal level of importance. The key is just doing something, not nothing. Would would you say that's correct?
Absolutely. And, the thing to always remember too is the strength and flexibility are going to allow you to maintain mobility. That's how I'd really look at it. It's really important, particularly as we age.
Absolutely. What we've encountered sometimes is, especially with the older adult, is that there's sometimes a fear, right, and maybe an intimidation regarding strength training, and moving into these ranges of motions that maybe they haven't put their bodies into before. And it's kind of this thing we have to work through with. Well, we can start with just your body weight. We don't have to get crazy with adding a lot of load.
That's right.
That can come in time and while your body starts to understand this is a safe spot to be, right? Um, I'm just curious, have you noticed anything with the mind to muscle connection? Um, I think sometimes again, getting to that fear, I know that the brain is powerful, right? And sometimes pain signals, at least again, I'll just speak to my own story. When I was doing my rehab, I remember times where I would get to a certain point, let's say just trying to like reach down and touch my toes, and my body, I would just be inhibited. Like I could not get lower. Sometimes there was a pain signal, and it's funny because I was like thinking to myself, "Wow, this is so interesting because the the pain, the inflammation is gone. Like this epidural worked, right? Like maybe there's something else that was causing it, possibly. I don't know. But for the most part, I'm like, this is so interesting. I felt like it was my brain literally telling me, hey, you know what? You went into this position before. It didn't work out so well. So let's tread cautiously here. Do you think that is, a component of this where sometimes the brain remembers it wants to keep you in safe positions, right? It's a primal thing that's like its job is to do that. Does that play a role in any of this that you see with patients?
Yeah, absolutely. But I think the other thing to remember is the we all have to adapt in how we train and how we do life as we age and as we become injured. And a lot of things to remember is, a lot of maybe the things that you were doing got you in the predicament in the first place and maybe
Right.
best avoided. I look at my job as not only making the accurate diagnosis and helping them manage their symptoms and get them back on the track of being active, but also to guide them and tell them the types of things that not only should they do, but the activities that need to be absolutely avoided or they can make the condition worse.
Worse. Correct. Awesome. I appreciate that. Yeah. And I think sometimes that's, especially if it's ones that people enjoy doing, they may have to reevaluate
Well,
where those
you know what they
activities come
say,
back in.
John, it's hard to treat an old dog new tricks, right? That's a say speaking to you, my friend, but
Is there anything else, I guess, with specifically as people are, as we're getting older, what I find is that again, there's sometimes people are still very active, but sometimes they're more sedentary. And in doing so, fitness starts to wane, strength starts to wane. Um, in your opinion, what are maybe the top two or three things that people can really just start to do that will help maybe not necessarily alleviate certain back pain, but possibly put them in a position to be more resilient, where they can actually be more prepared for anything that happens in the future?
Yeah, I think the key thing as we all age is to keep moving. Find an
Yeah,
activity that you're excited about and do that activity, whether it's, bicycling, whether it's pickleball, whether it's tennis, golf, whatever. But also, you've got to do the foundational things as we talked about with core strengthening and flexibility so that you can do those things. And I think, you also have to be really dialed in on diet and get appropriate rest so you can recover. All those things are very, very important. And, the crazy thing, I mean, I wish I could still train like I did when I was 18, but that's not reality. As we get older,
right,
our bodies change. And, that's the beauty of, I think, weight training because you can adjust exercise based on where you are in your life or
mhm,
any injury that you have. And you can continue to train and not, re injure yourself or prolong the agony of your pain. But
right,
I think the biggest thing is, and it's a fight I have with a lot of my patients. I've been doing this 34 years. I'm seeing people that I
yeah,
haven't seen in 30 years. And the first thing I ask them when I see them again is that, whether or not they're doing their exercise every day. And invariably the answer is no. So that's the
mm,
first bone of contention and discussion we have. I get them back on
yeah,
their exercise. But I think the mistake a lot of people do is they throw up their arms as they age. They don't like the way their bodies change and the way they feel. And
mhm,
they stop doing things. And I think that's the biggest mistake that you can make. I think it's very, very important. Find a passion, but also like if you're not doing anything that really elevates your heart rate and get for a conditioning effect, then you got to incorporate some cardiovascular conditioning to
right,
accomplish that. So those are the
yeah.
kind of things that I really talk to my patients about.
I love that. Yeah, and I think just to reflect back, what I heard because it's, uh, the simplicity is the beauty in it, right? It's just keep moving, right? And
Yep.
something you're passionate about or actually sounds exciting or fun to do, um, and do it at whatever level you can, right? I mean, that could be basketball, but it doesn't
Right.
mean you have to go out and just go full court for 60 minutes with a bunch of people that are 20 years younger than you. Just go shoot some hoops, right? Do something minimal, but just
Exactly.
because you want to do it, stay moving. I heard the overall strength component, right? Whether that's total body strength, core strength, mobility, kind of all into one. And then the huge, I think, kind of often overlooked piece of how nutrition complements that. Whether that's enough protein intake to stimulate that muscle protein synthesis and either grow or sustain the muscle tissue that we have,
Right.
or the recovery aspect of just sleep, right? All things I think that are so important, and that if people can't do them, like, yeah, it doesn't have to be a place like Method 3. Go somewhere, like get someone to
Yeah,
help you
for
do those
sure.
things because the benefit and the ROI is incredible. on the other end,
Is
so you can enjoy
and
the year, right?
unfortunately, a lot of physicians aren't comfortable talking about diet, but it's so important. I mean, I tell my patients they've got to view their bodies as Ferraris, and you got to pump in the premium
Yes.
fuel. You can't expect your body to perform at optimal levels if you're not treating it correctly. You're not getting adequate
Yeah.
rest. You're not feeding it great quality lean protein and complex carbohydrate. How's it going to function optimally? It's not.
Yeah. It's not. Exactly. Totally. So I want to talk because you touched on recovery, and I'm curious. Someone gets injured, they whether they come to see you or they've got an injury they're kind of working on. I think sometimes people forget or I don't care. I don't know that recovery is probably different, you know, in their 50s, 60s, 70s than it was when they were 20. Right.
For
And
sure.
so yeah, how should they think about recovery now, right? 50s, 60s, 70s. Like, how should they approach that versus like in their 20s? Honestly, a lot of times, like, oh man, injury. Okay. Yeah, I'll hang loose for like a day, probably get back after it. Right. So
Right.
it's like
Yeah.
now, how should people be thinking about that?
Yeah, I think that's a great question. I think when I was in, my teens and 20s and 30s, I mean, I always thought go heavy or go home type mentality.
Yeah.
And I realized, thank God, in my 30s, that if I continued down that path, my training days are going to be over very, very quickly. And
Right.
I talked to my training partners about it and they kind of laughed at me and said, whatever, but what I've learned as I've gotten older is I think it's important to train, but you have to train smartly. So my
Mm,
intensity now isn't heavy lifts with repetitions in the range of 6 to 8. It's, much lighter weights, repetitions in the range of 15 to 20 and fast tempo between
mm,
sets. So I literally go from one exercise to the next. And so you're
mhm.
just trading off of the intensity level. And, the other thing I really talk to my patients about is as we get older in life, your life in training becomes a marathon, not a sprint. When you're younger, you think it's a sprint, time's a
Yeah.
wasting. You got to be strong and fast and flexible and do all these things. But as we get older, it's all about maintenance of health. That's what really matters and consistency with training. It doesn't make any sense
Yeah.
to go heavy and hurt yourself and then you can't train for 6 or 8 months. Then you're starting from ground
Right.
zero.
Yeah. That's absolutely right. And it is interesting how that starts to shift into more of a longer term approach, and thought process. And it's exactly what we talk a lot about because it's especially in this day and age, a lot of people talking about longevity, big buzzword, and which I love, and strength training and everything else because it's 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 one thing to live longer, but it's another thing altogether to be able to actually have like vitality during those years, right? And
Right.
so and consistency is the name of the game. So, Dr. Millard, in your again, at 34 years, you've seen a lot. I'm curious for a lot of people. I think as we get older, right, we have an injury, let's say like a back injury, which can feel, wow, I am, this is going to take significant time expertise from someone like you, but maybe intervention, and then a significant time to like rehab properly, there is this fear that kind of exists. And sometimes that could be paralyzing, I'd say, for some people. So, are there any conversations you have with people sometimes post, during their recovery, right? Some sort of conversation about how to approach movement again or how to maybe overcome that fear?
Yeah, that's a great question. I think again, my job is to really instruct them in trying to avoid the types of exercise or movements or sitting too long or lifting incorrectly that could potentially re-injure them or cause a significant flare up. And
Mm,
one of the things we've talked about is shutting down the pain with procedures like epidurals, allowing the nerve to heal. But then it's still a process wherein the disc has to heal, and that takes time.
mm,
That doesn't happen overnight. So what I also really help my patients try to understand is, hey, there's going to be days when you don't feel great, and you have to be careful those days. Those are the days you're
yeah,
you're trying to stay active, do something that doesn't really put the pain at a very significant level, but understand you're going to start having more and more good days as your disc heals. And So again, it comes down to avoiding the types of things with disc herniations like sitting too long, lifting incorrectly, staying true to the core. And I think, unfortunately, a lot of people, the fear factor does overcome them and they start having a flare up and they stop doing the most important thing, which is continue to try to core exercise at some level to allow for the
Yeah.
healing to be ongoing. So I think
Yeah.
again, it's a discussion. It's encouraging them. It's preparing them for potential side effects or little flare ups here and there, but having them also understand there's ways that they can manage those with like non-steroidal anti-inflammatory modalities like ice and heat, extra strength Tylenol to really keep them on the path of recovery.
Yeah. And I think the one thing I think you touched on there too was even just the length of time for the disc then to heal, right? Inflammation is gone, but this is going to take time. And that's one thing you were very upfront with. I remember just again coming back to my story, was just setting the expectation, right? Of like, hey, yeah, you had this thing, you're going to do the work, but guess what? It's not going to like 6 weeks and you're just back to like, doing this. It's going to take time. And sometimes that can feel, whether that's defeating and or if I have that little flare up, the fear comes back and then I want to just stop, right? Instead of kind of listening to it, resting or changing the routine if appropriate, but not stopping per se, right? So, we talked about a lot, Dr. Millard. I'm curious if you had to whittle it down to just, two or three things that, hey, uh, someone over 50, I want to stay active. I want to stay strong. I want to stay independent over the next 20, 30, 40 plus years. What would some of those things be? What would that prescription for living stronger for today look like?
Yeah, I think again, it comes down to, preparing your body to be active. I think the core strengthening, things like front planks on your elbows and toes, crunches, a lot of stretching, quads, hamstrings, hip flexors, glutes, really, really important. I really think front and side planks are an awesome overall strengthening exercise for all the muscles that are important in spine. So I would definitely say do the foundational work, but you also have to cover the cardiovascular fitness side of things. You've got to cover the strength side of things. Again, it's keep moving, find an exercise if it's not weight training or running or anything more active. Find something you're passionate about, but fill in the gaps with
Yeah.
training on your own, I would say. And then again,
Yeah.
it's about getting adequate rest. For your body to perform optimally, you have to get rest so that it can perform. And again, diet is so, so important. As we get older, our metabolism completely changes. And if you're not really tight on your diet, it's easy to pack on weight in a hurry. And that really works against all orthopedic injuries from your
Mm.
spine to your hips to your knees to your feet to your ankles, everything, right? So I think diet is absolutely crucial. Have your diet dialed in, get your rest and exercise at some level every day, and you have a great long life, healthy.
And if anything comes up, they can come see you, right? Just like
That's
a lot
right.
of us
I'm
did here.
there. I'm
So
there to fill in the gaps if they need me.
excellent. Well, really appreciate your time, Dr. Millard. I know a lot of people listening, watching, are going to get a lot of value out of this. And thanks for all you do for, not just myself and my family, but the community at large. Very much appreciate it.
Yeah, thanks for your kind words, man. It was my pleasure to treat you and your family, and it's truly a blessing when you love what you do and you're able to really help people get back to an active life. Because I've dealt with my share of injuries as well, and it's really disturbing when it's a part of your hard drive. You're athletic and you want to be active and fit, and you can't. So I feel
Yeah.
people's pain when they're unable to be as active as they'd like. So I'm compassionate and I'm motivated to get them well.
Excellent. Well, thank you again. And for all of you watching, hope you enjoyed this episode of the Stronger for Today show. And we'll see you next time.